Okay, good morning, guys. We're in Jacksonville, Florida at First Coast Cardiovascular Institute's Comprehensive Vein Center. And I have Dr. Roberts to my right, and I have Dana on the left. They'll be assisting me in this procedure. Today, we will be demonstrating how to perform laser ablation of accessory vein that feeds into the great saphenous vein. So we have our patient today who has stage 4 or class 4B disease with venous insufficiency. As you can see, he has significant skin discoloration. He has a swollen left lower extremity. His leg has been painful. So we have done our prior lower extremity venous insufficiency study, and we know that he has severe reflux in the accessory vein. What makes this procedure interesting is that he has already had a below the knee GSV harvestation. So his great saphenous vein has been removed already, but he does have a significant segment above the thigh that does reflux. So Jason is going to be assisting me in the ultrasound part of this procedure. So we're going to start. Jason, let's take our positions. So the first thing we do is we will be using 1% lidocaine to anesthetize the skin over the vein, and Jason is going to. So Jason, can you just show them what you're looking at right now on the screen and how we're going to take it from there?
So if you look at the screen right now, we know that he's already had a large portion of the GSV below the knee harvested, and that bright thing in the middle is actually, a residual staple. So, and then below this point is where it becomes non-existent. So what we're going to do is we're going to come above this. Since the native GSV is gone, we've already mapped the leg. It's going to be a little bit of a tricky case, I think. First thing you want to do is assess the leg, look at the anatomy, follow it all the way up, and stage your case from that. Okay. So I think that's the most important part, definitely here.
All right, Jason, so will you scan the leg, Jason, and show us where our access point will be, and kind of show us on the screen what you're looking at?
Sure. So what Dr. Ali stated to begin with is that the patient obviously had the below knee GSV harvested. So, and we're going to be accessing the accessory saphenous and actually following that in to the native great saphenous vein in the thigh. So what makes this a little trickier is that you definitely want to stage the procedure first, look at the anatomy in the leg. We've already, came up with a good spot. But if you can see down here, there's really not much going down here. You can see there's some varicosities. So it's going to be a difficult case for Dr. Ali to pilot through some of these veins, but we've done many cases like this, so I think we're going to be okay. So first of all, I think what we're going to do is we're going to try to get access around in this area here, in this zone. Let's just double check and make sure that we have everything that we need. As you can see, the GSV, once again, it's been harvested, so it breaks apart, and this is pretty classic for somebody who's had a harvested vessel. So I think what we're going to do is maybe come up above this just a little bit, the area I just showed you, and maybe right here, which is not always the ideal spot by the knee, but it's a good sized vessel, and it actually tracks up really nicely. So if Dr. Ali is okay with
Come down, Jason, a little bit below the knee. Keep coming down.
See what happens. It breaks. So
I think we can take it right there. So if you come down a little bit, right there, okay. Right there. So if you can come down a little bit more, Jason, can you scan a little bit more down? Yeah, keep going, and we'll see if it goes through the tortuous segment or not.
It breaks apart, so I think.
Okay, we'll take it right there. So I'm going to numb him up a little bit. So here's a little needle and little numbings. As you can see, I'm putting some lidocaine right above the vein. And
you can do it with or without lidocaine. I think sometimes, depending on 2 sticks or 1, I guess it's just definite preference.
So now what I do is before I start poking with my needle, I kind of press the skin with my finger to see where my needle's going to be, get a pretty good assessment of this, and then I have the needle going right where it needs to be, and I'm watching it on the screen. You can see I bring it in the picture, kind of scan it slowly, and I enter the vein, and I see if there's a little flash of blood. So I don't think I'm quite in yet, but what makes me think that I'm in is you can see the blood return from the needle. So I'm going to now try to introduce this wire through this segment and see if it goes. And again, it is kind of rolling, so it's not, it's through and through probably. So I'm going to come back a little bit and see where we are. Okay, so we're here now. We'll try it again and see if this wire goes. And again, you know, like I said, our cases are a little bit tricky because they've had previous issues, so they're not as straightforward. So where, can you show me this in the vein? Yeah.
It's actually at the top.
So I may have to come up a little bit here.
So maybe a little bit here.
Yeah. You're, come closer to me a little.
You got it. Boom. There's the tip.
Yeah, but it's kind of out of the loop.
Go over a little bit. Yeah, right there.
Yeah, once I get this in, I'll give you some numbing medicine. This vein is not cooperating with us. So that might be in, we can try.
We can come up a little bit more. I think this would be a better spot. Hang on, a little poke.
So I'm scanning it a little bit slowly.
Just take a deep breath in through your nose and
Yeah,
out.
I'll give you some. You're too far away from me, Jason. Come close to me, Jason.
Don't hold your breath.
Yeah, but this, I can try it again, and we have some good flow here. And now we're in the lumen, as you can see, the wire went straight in there. Okay.
So it's still going pretty
Yeah.
smooth.
Well, here it gets a little stuck.
We might have
So we get through now. We got it. So I'll give a little bit more lidocaine at the access point, and here I'm giving you some more numbing, and then I'm going to give you. So you can do this procedure totally under local anesthesia, but in this patient here, we'll be using a little bit more conscious sedation. So we will be giving him. Yeah.
Okay, so let me go ahead and show you the wire. So once again, it was a difficult access. We finally got it. And if you can take a look in the transverse shot here, you can see the wire inside the vein now. I definitely recommend tracking it up in transverse, keeping your eye on the wire. And here you can see the vessel as it dives down exactly where we want it to go. So for now, we do have the guide wire in the accessory vein. You can see to the top right. Open it up for you from the top right here, and then you can see another branch that comes off, and then we actually dive deep, and that's exactly where we want to be heading into the native GSV. So for now, we're in a good position.
All right, so let's get this hypotube in there, which is the catheter or the plastic tube that allows me to put the 035 wire in there. So I'm advancing this nicely. Should not give you any trouble. Once I get this in, Dana, we'll have some, so we'll be using Versed and fentanyl. Jason, can you draw that up from her, please? Okay, so now we'll try to put this 035 J-tip wire through this access. Okay. So it should go smooth, and we have some tortuosity. Yeah, this wire may not go, Jason.
We have another one if you want.
What do you have? Night view? Let's try the night view wire.
Yeah, some other ones too.
Yeah, I had a feeling it will not go.
We can always just
So, Yeah, this wire sometimes will not track through the tortuous segments. So what we do is we use a hydrophilic 018 wire, which is called, we have here today a night view wire, and we'll be using this. So I'm going to try to advance this wire through, and Jason will guide me with the ultrasound to see exactly where the wire goes. So it's moving smooth, and we'll see up on the upper thigh, Jason, where the wire exits. So I think it looks good. We'll confirm it. Yeah.
And you can see it here down.
There it is.
The native GSV coming up.
And you can see the wire coming in through it as well.
Let me give you a good shot. There we go. So, and here we go. Let me identify the junction for you by ultrasound. Here's the SAFM junction here. Common femoral is going to be down here. Here's that gastric vein. Here's our GSV coming in. And Dr. Ali will see the wire right here sitting at the bottom.
So I am moving the wire back and forth, but let's scan it back and see if the wire is back. I think it's there.
You can see the
yeah, I
wire
think it's
here.
there. It's a thinner wire. So, okay, let's try to bring a catheter up now, Jason.
Sure.
Okay, so we'll remove this. So he's loading this wire on this. So let me see if it advances smoothly. If not, you can always give a little incision. So he has a lot of scar tissue in here as well. So I think it would be better if I give a little nick here. So So yeah, he has a lot of scar tissue, Jason. Yeah, there is significant scarring here. Okay. Will you pull the wire back just here, please?
Sure.
Yeah, it won't go. It's just too scarred up. Okay, so I'm gonna just take a peek at it here and maybe try to give a little more nick. Yeah,
Grabs the wire.
just too much scarring.
I'm trying another sheet. I have other sheets.
The sheet should go. Let me advance the sheet a little bit, wire a little bit more. Okay, so let me try this again. Yeah, there you go. So sometimes it hangs up or catches in the tissue, and you just have to be careful that it tracks nicely. Let's go take a look, Jason, and see where it's going now. So you see the catheter coming up now, or?
Keep coming.
Okay,
Okay.
so there is the catheter coming up.
And then
So now I can withdraw the wire, and I'm going to withdraw the wire because we know we're in good position. So I'm removing the wire back, and what you see up on the screen is the double lumen of the catheter that will in fact have the laser fiber in it. So I position it here. Okay. So this was again a little technically challenging because you will encounter patients like this who've had previous vein harvesting. They will have scar tissue. They will have some tortuosity in the superficial venous system. So you kind of have to just guide your way around it and use hydrophilic wires if you have to, and support catheters if you have to put your laser fiber and sheath in position. So now Jason is putting the laser fiber in there, and he locked it. And now he will rescan the leg to sort of confirm our final positions where we are. Okay. So we're going to withdraw the catheter back because we want to be about 2 to 3 centimeters away from the saphenofemoral junction.
And you can see here, once you're up top, this actual kit, the laser actually comes out 2 centimeters from the front of the catheter itself. So catheter is here. Here's the gold fiber. Here's the gold tip. And we want to be a good 2 centimeters away from that terminal valve or the gastric vein that you can see coming in here. We got a good run. Maybe we can come back a little bit.
Okay, sure. So we come back just to here, about right here.
So we're good. You can measure with the caliper on screen, which is perfectly fine. We've done thousands of them, so we can generally just eyeball it, but I'll give you some reference here if you'd like. So we're about 2 centimeters here. So we're good with the placement, and we'll lock in the sheet.
And the laser catheter itself has markings on it. It's a 60 centimeter sheet, so we are at 38 cms at this point, and we have made our mark there. So
just one more time, let's take one more scan. I know we're pretty good, but there's no harm, no foul in looking again. And you can see the catheter, the whole kit inside the vein. That's the accessory vein here. It dives into the saphenous vein and gets a little bit deeper.
It's okay. So take some deep breaths.
Take a deep breath for me.
So we are pretty good. Sure.
Yeah, don't forget to breathe, my friend. So as we've given a little systemic anesthetic here, so little conscious sedation, so take deep breaths in. So we have a sat monitor, we're watching it. We have a blood pressure, we're watching that. So what Jason will do now is he will do ultrasound guided injection of tumescent around the vein. So we want to be in the perivenular space of the vein. As you can see, he is trying to compress the vein. And the solution we're using is normal saline, lidocaine, and epinephrine.
Oh, but I'm not peeing my pants?
No.
Okay, good.
Yeah, you're doing good, sir. Yeah, this is just the fluid that's draining out of that. So typically we want to put about 200 to 250 cc's of fluid in one leg. Depending upon the length, of course, it can vary. So Jason is trying to create a nice halo around the vein. So Jason, if you can just show them what you're doing.
Sure. Since this is not in the saphenous sheath, it's the accessory vein, it's actually outside in the tissue. So what we would like to do is get inside of the perivenal space. This doesn't have that. So we're just going to try to get the best halo we can around the vein until it actually empties into the great saphenous vein, and then we'll create a better buffer. But what we like to see is this nice halo here. So we'll do the best that we can with this and get some fluid around it. And that's all we're doing here, is just getting some fluid around it. And you can see as it dives down a little bit deeper here.
Yep. You're doing very good, sir. Just a couple more needle pokes and we'll be on our way.
Yeah,
Try not to hold your breath, okay?
I'm trying not to.
All right.
Ooh.
So once again, the saphenous vein is pretty deep into the thigh here. So we're just going to keep tracking it up. And
Oh,
Yeah, this just one last one, and obviously, as you know, this is a pretty sensitive area, so some people, everybody reacts differently, and your patient can have a little discomfort, but generally, like I said, we can do the procedure under local anesthetic, and but we do have availability of systemic conscious sedation if so be desired by the patients. All right, so we are, I think, pretty close, Jason. I think we're pretty good up there.
yeah. I'm about to forget all this by next week.
Yes, sir, you will. You will.
Yeah, I gotta get the other legs done next week.
Okay, so let's see, Jason. So after we've done this, we kind of take another final look at this to make sure our catheter hasn't moved while we're doing the tumescence.
So, as you can see, the catheter
Yeah,
hasn't
I
moved.
think we're good.
We're good?
So we are at 37 centimeters, and typically 7 seconds per centimeter is what I use on my pullback. So people have used manual pullbacks as well as motorized pullback rails. We're very used to doing the manual, so I think we are timing ourselves at approximately 280 seconds of laser time. Okay, everybody ready to go? All right, so as soon as I start the laser fiber, you can see the very echogenic area on the screen where the vein is actually closing behind the catheter. So what's happening is that there's denaturation of the protein in the vessel wall, and that's actually causing a little inflammation and closing the vein. So that's the whole procedure. And you want to do a very gentle, nice, smooth pullback and deliver about 10 watts, 60 watts of energy per segment. So you can, Jason, can you point them what's going on the screen?
Sure, so you can actually see here's the catheter inside the vein, and this is actually the action here. So this laser fires a little bit forward, and you can actually see the steam bubble in front. There we go, that's a better picture of it here. So this is a steam bubble here coming out of the front tip of the catheter.
So if you've done a good job of tumescence, your patient should be very nice and comfortable, as we have over here. And if any time your patient experiences pain, then you should immediately stop and kind of reassess. You may need to give additional tumescence, and then you can proceed with the procedure after that.
And if we can hit the lights, we'll show you this catheter actually has an aiming beam. So
Take a deep breath for me.
you're not going to be able to see it on
He's a little deep, yeah.
He's a little bit deep, so you're not going to be able to see the aiming beam on him. But as it comes closer to the surface, it'll eventually come up.
So we can turn the light back on, Heather. Yeah, once it comes out. So remember, this was a accessory vein that drained into the great saphenous vein above the thigh, and so we're coming back slowly.
So, Dr. Ali, on a scale of 1 to 10, how would you grade this case?
I think this was a pretty difficult case. This patient has been through a lot. So we are demonstrating to you a very technically challenging case, from access standpoint, and we've shown you how to negotiate tortuosity if you encounter that with using additional wires and support catheters. So if the procedure is done properly, you can pretty much tackle most of these veins and help your patients live a very good, healthy life, and symptom-free mostly. So I'm going to continue with my pullback. And I'm watching on this pulse generator. You can see it shows you how many joules of energy I've given and what my rate of pullback is. If you can remove this tubing a little bit so I can show them the seconds. Yeah. So we know we need to be about 280 seconds for a complete pullback, and I'm at 192 right now. So I think we will be very much on the money here.
So now you can start to see the aiming beam as it comes a little bit closer to the surface here. Really it's just like Dr. Ali said, you do have manual pullback going on here or versus the automatic, so you need to have some sort of rhythm. So many operators like to actually watch the light, listen to the music, and have their own rhythm.
So I think we're doing pretty good, guys, here. We are now in the accessory part of the vein. So we can turn the lights back on. So we have about 5 centimeters to go, and we'll be pretty much on the money here.
Another deep breath for me.
We start to see the markers here.
All right, so we're almost at the end, and that's it. So now I'm going to remove the catheter, and Jason's going to apply manual pressure. And then from here onwards, what we do is he will put a nice dressing on this with a little bit of compression. Patient goes home around, and after 6 hours takes that dressing off, and then they can put a compression hose stocking for about 2 weeks. And we do tell them to avoid submerging themselves and taking a bath for the first 48 hours until this thing sort of heals. We do encourage them to walk, so with this procedure they can actually return back to work the next day. So there's minimal time away from work. Patient can ambulate as soon as the procedure is done. It's very quick recovery. So now we can go ahead and let's put the dressing on, Jason. Okay. So you want to just show them, stand on this side so they can.
Yep.
Okay.
So what we'll do is we're going to wrap it up from the foot up. So,
I'll keep it there.
Yep. So just kind of hold it right here.
Yeah.
Let me get the first wrap on it.
Yeah, and then you can show it to them. Go on the side. I'll hold it up here.
Okay.
Stand on this side, right? Yeah.
Okay. And what we're going to do is just put a nice big bulky wrap on it. We put the tumescence in the leg. It's definitely going to come out. So we want to grab as much as we can. We used to send them home with this wrap and their stocking on all together. But from the feedback from the patient, we decided that it's too messy with the stocking and the wrap on. The stocking ends up getting wet and the patient has to sleep in it overnight anyway. So we decided to just wrap their legs up nice and tight and send them home. This way, if it does become wet, we can cut it off and they can put their stocking on.
All right, go ahead with that.
Same thing.
So not too tight because you don't want to cause pain. But enough to keep the pressure on the vein that was just ablated so it kind of seals off nicely.
Let me come over there.
Yeah. Come on this side. Yeah. All right, very good, Jason. Once again, guys, we've shown you how to do a very complex accessory vein ablation into the great saphenous vein, and I think our procedure took less than 45 minutes, and I think we're going to have a very nice result. So thank you very much, Jason, and thank you very much, Dana, for helping me. Thanks a lot, guys. Goodbye from Jacksonville, Florida.